I'll just be introducing you and then you can start.
Sounds good.
Hello, everyone. Thank you for joining our virtual dental shadower session. We want to remind you today that we will not be having a quiz, but for more information, you can visit our link tree, which is in our Instagram bio. All right, let's get started. We are very, very fortunate to have Diana for today's session. I'm handing the mic to you. Feel free to start whenever you want.
Sounds good. Awesome. Well, thank you so much for having me. My name is Diana Kim, and I am a third year, soon to be D4 at Stony Brook School of Dental Medicine. So I will go ahead and just get started. Some background information on myself. Like I said, I'm a third year at Stony Brook. I went to Northeastern University and I graduated in 2016. And my major was biology with a health science minor. And then I proceeded to do a gap year at Bicon Dental Implants, which is a dental implant company. Some of the extracurriculars that I've done is Global Medical Brigades, Pre-Dental Association. I also danced on a dance team, and I'm pretty much very involved in dental school in terms of extracurriculars, leadership opportunities, that sort of thing. So if anyone has any questions in regards to that, I will be more than happy to answer. I'm pretty involved on ASM. And this year I am on the Council on Membership. I'm also involved with a GD and some in-school Office of Admissions work study positions. In general, I wanted to just kind of be transparent about my journey. I applied to 14 schools. I interviewed at 5, and I was lucky enough to have 4 acceptances going into dental school, for which I was able to kind of make the choices that, I did, and the things that are very important to me in terms of the dental school that I ended up at. So the first thing that I wanted to kind of talk about is tips for taking the DAT. So again, in effort to be very transparent, I applied with a very low GPA. And I say very low because it is definitely on the lower range of that, average DAT score, average GPA. And so part of the first thing that I wanted to note is knowing your strengths and weaknesses. I applied with a couple of C's, and I actually think I had 3 C's, and I knew that that was going to be a weakness in my application. So I had to make sure that going into the DAT, for example, if I know I had, let's say, a C in organic chemistry, I knew that this was my second chance to prove to the dental school admissions teams that I am, I'm good at being able to improve on the things that I haven't gotten a chance to, really show off on my application. So I had that C in organic chemistry, and I really had to focus on orgo this time around when I was doing the DAT. So knowing your strengths and weaknesses is definitely something that's really important, because you want to understand what you're trying to achieve with this DAT. For me, I wanted to prove myself that I can do well in organic and that I was able to kind of be a well-rounded person. I also want, like I said, to see it as an opportunity to explain your GPA, because you can't really go back and change your GPA, but if you're in the position where you're taking the DAT right now, you are able to take control over that. So that's just kind of my big tip on the DAT. And then also having realistic goals. I actually mentor a lot of pre-dental students, and I can't tell you how many people are telling me, my goal is to get a 29 out of 30 on the DAT. And I want to stress the importance of having specific but realistic goals for yourself and for the schools that you're hoping to get into, because that will change whether you're looking to get into, let's say, one school over another school, whether it's a state school, whether it's a private school, and how competitive those schools are. In terms of specifics, the DAT, I used DAT Bootcamp. I did Chad's videos. I learned a lot from Ninja Nerd. those typical resources. But I think the most important thing is setting time aside. I knew I wasn't able to be in classes full time and also study, be working and also study for the DAT. So I took about 2 to 3 months to just focus on the DAT. And that was my way of tackling it. Also, a great tip if you don't want to keep pushing your DAT. I actually, traveled right after. So I knew I had to force myself to really take the DAT and not keep pushing it until I felt really ready, because I feel like with the DAT, a lot of people don't actually come to a point where they feel like they're ready. So you just have to know yourself and how you study, how you function, to make that decision for yourself. Okay, so moving on. Advice on staying motivated. So this is something that I'm really passionate about. And I came up with 5 specific actionable goals that I think that any pre-dental student can benefit from. The first thing is to establish your why statement. And I'm going to talk a little bit more about that in the next couple of slides. Reframing your goals and focus on the feelings you're hoping to achieve, understanding your energy levels, and making sure your daily actions align with your priorities. There's also podcasts, books, audiobooks, and YouTube videos that you can use to stay motivated. But I want to specifically go to number 3. Understanding your energy levels. What I mean by that is there are going to be times when you're exhausted and you have to study for the DAT, and you have to assess what energy levels you have at the moment, because some people actually spend, let's say, 6 hours and they're not in the right mindset, but they're just forcing themselves to study and study and study for the DAT. But what's more important is to know the environment that you best study in, know the people that you surround yourself. What does that look like? Does it look like a coffee shop? Does it look like going to the library where you can't really, take a nap readily? Those things are really important. So don't lock yourself into being like, for the DAT, I have to study from 8 to 8 p.m. That's not realistic. If that works for you, then great. But if you wake up really tired one day, you want to focus your energy on doing things that are not that much consuming. For example, studying for the PAT, or maybe reading some scientific articles or whatever it may be. That you don't have to stick to this rigid system, because I feel like a lot of people set themselves up for disappointment and failure when they have specific goals that are very rigid, especially when it comes to studying for the DAT. So I'm going to talk a little bit more about the first 2 bullet points there. So I used to have my to-do list before used to be, get into college, do well on the DAT, get into dental school, and then become dentist, right? So those things are very, very vague, and they don't allow us to have specific goals. So then I kind of changed my mindset, and changed it more so to being more specific, those SMART goals. It has to be specific. There has to be a time aspect to it, whatever it may be. So then I became a little bit more specific. So it's exercise 5 times a week for an hour, wake up at 6 a.m., get an A in anatomy. So all of that is great, but I want to take it a step further. I want everyone to kind of think about all those things that you're aiming to do: exercising, waking up, getting A's, getting a 30 on the DAT, whatever that specific goal may be. You want to ask yourself why. What are you hoping to achieve by actually achieving that goal, right? So if you ask me why I wanted to do those 3 specific things, is kind of going off of this to feel list. And the idea behind this is, what are you hoping to achieve? What feeling are you hoping to achieve by that, right? So feeling energized on a daily 20-minute walk. So if I can feel energized, maybe I don't have to exercise 5 days a week for an hour, right? So what do you hope to get out of those specific goals? I wanted to feel rested. So it's okay if I don't wake up at 6 o'clock. But if I wake up at 7:30 and I prepare my breakfast and tidy up my room the night before, these are ways that you can make yourself feel better, stay motivated, and not disappointed in some of the goals that you may not be meeting, right? And then in terms of, switching that mindset from getting an A in the course, but less so on the grades, but focusing on what you're hoping to achieve. So I kind of want to, encourage everyone to think about why you're doing these things, less so it being a checklist. I have to get community service, I have to get shadowing hours, etc. So that's my little spiel on why. So the next topic that I was asked to talk about is community service. And this is something that's very, very near and dear to my heart ever since college. So I was the co-founder of Global Medical Brigades at Northeastern University, where we took 35 students and we set up a medical dental clinic in a school. And we went there for a week. So it was an amazing opportunity because we get to learn firsthand. We were assisting some of the dentists that we brought along. And then there was also a public health component where we built latrines. So this was an amazing cultural experience, dental experience, community. We built a community and we prepared 6 months for this big trip. So I'm very grateful, and I think that Northeastern University is still doing trips from Global Medical Brigades, which makes me really proud that it is continuing to grow. So the next thing is Give Kids a Smile. That's community service that you as future dental students will get a chance to participate in, because every dental society or organizations, organized dentistry, they host Give Kids a Smile, where we were able to go to a museum and see elementary school kids. We did oral cancer screenings on them, intraoral exams, anything. And we were D2s at that point. So that was really exciting for us. And at Stony Brook specifically, we have something that's called Com University Day, where there is, it's basically like a fair, a school-wide fair. And we brought our dental care mobile van there, and we did oral cancer screenings as well, oral hygiene instructions, and we were walking around teaching kids how to brush their teeth. So that's something that I'm involved in. And the takeaway here is for you to be really vocal about your dreams and aspirations to the people that can give you these opportunities. So if you are interested in community service, but you find it hard to find, especially in this post-COVID age, I really want to encourage people to speak up and tell older dental students or mentors, hey, I'm interested in community service, because what that does is it bridges this gap. Because no one can read your mind, right? So, and those people can give you the opportunities that you're looking for. So there are so many D1s that come to me and they say, I really want to get involved. I see that you're involved. How do I get involved with ASDA? I keep them in mind. So when I know that there's like applications for the e-board that comes out, I immediately tell them, hey, you should go to this webinar, or you should go to this service project day. You should talk to this person because they are really interested in the field that you're interested in. And what I do is I essentially just facilitate that connection. And if you aren't vocal about your dreams and goals, I feel like those things don't come to you as easily. And a lot of dental students are very hesitant, and pre-dental students hesitant about saying what they're up to, because there's a little bit of that feel when you're comparing yourself to other students that are applying. Will you get in? Will they also do that sort of thing? So really just try to be mindful about that. And it's totally okay to be vocal about your dreams. Okay. So I wanted to talk a little bit more about choosing dental schools. And like I said, I applied to 14, and I applied to 14 because I definitely was not confident in my GPA. My DAT was okay, and I knew I had a lot of extracurricular activities, and my personal statement was good, but I really was worried that my GPA wasn't high enough to, get me through the door and get interviews. So the first thing that I would do, actionable items, again, this is something that I'm really focused on, is choosing 3 things that are important to you from a dental school. For example, location. Seems, a lot of people say, why do you want to go to X school? And usually just because it's located in New York City isn't enough. But choosing the three things that are important to you is a good starting point. So if faculty is important to you, you want to ask the dental students, what is your faculty coverage in clinic? What something that's important for Stony Brook, for example, is the same professors that we see in our didactic courses, pre-clinic simulation lab courses, are the same faculty that we work in clinic. So once you start fostering those relationships early on, you can you will already have that relationship going into the clinic, right? It's different because not all schools are like that. There are some schools where it's very segmented, where you kind of have to start over as a third year, and then it's about to be this residency portion of your application. So that's something that's really important to me. Whether it has digital dentistry, whether there are enough chairs, whether you have to find your own patients. At Stony Brook, we don't have to do that. We have plenty of patients. And of course, there are definitely challenges at Stony Brook, but that's something that was important to me. I didn't want to ask my dad to come in to get a crown. Like, that's not something that I was interested in. And then the next thing is scheduling one-on-one conversations with dental students. And I mean outside of school events. So if you are at an event and you see a dental student, you definitely want to come up to them, give them or ask for their email, set up a 15-minute Zoom call, and just get an idea of those things that are important to you. For example, if diversity and inclusion is really important to you, I would talk to the dental students, because a lot of schools say they value diversity and inclusion, but maybe in real life on the daily basis, that's not something that's visible to dental students, and they don't feel that inclusive environment. So that's not something that you would hear in an open house. That's not something that you would see on a brochure, but that's something that you can get a better understanding of by talking to dental students. Also recognizing what your desired mode of support is. So if you know yourself that under stressed environments, you want to go home to your family to spend time with them, and that's important, then I don't think that it makes sense for you to apply to schools where you know you won't have that support, and therefore you won't be as happy. So that's a little controversial, because there's some people that say, you have to apply everywhere, and the whole goal is just to get into a dental school. But really, I think the goal should be to get into the right dental school for you, the one that is your perfect fit. So that's really important. In addition to that, visiting the school, seeking out school events, and following the Instagram pages, I think is something that wasn't available to us before. So a lot of schools right now have, class of 2022 Facebook page or Instagram page for this. And so a lot of focus right now is on social media, which allows you to see day to day what dental students are doing. If someone posts, hey, it's my first crown prep, and they're like nearing their D4 year, like, that's something to consider if you're looking for a clinical experience. If you see the D2s are already seeing their own patients, that's something that I think is also really important. And then also, again, to reinforce this idea that you really want to reflect on where you thrive and what qualities of your surrounding environment makes you happy, because dental school is very difficult. I will say that. Taking the DAT, I feel like, is kind of the easy part now looking back, but you want to know what's important to you and where you thrive, and use that as a way to choose your dental schools. But with this whole application process, I think that everyone has individual goals and everyone's application looks different. So some of these things may not, apply to you. Okay, so choosing specialties, I will be open and say that I'm going into general dentistry. I am applying this summer, and something that's really important to me is digital dentistry, and being able to mentor and go into teaching at some point in some capacity. When you're choosing your specialties, you have to ask yourself whether you can see yourself doing this for the rest of your life. If you're not sure, you should do a GPR, you should do an AEGD to figure it out, because it's only really 1 year. in the grand scheme of things, if you find yourself going into endo because that's what you thought you wanted, but you weren't sure, you're kind of quote unquote stuck in that field, and you won't really be able to switch going back to general dentistry, right? So that's something to consider. When you're in sim lab, you want to kind of hone in on the things that make you happy. Do you enjoy making dentures? Do you enjoy it, but do you see yourself only doing those things, right? So I think that's really important. I think it's a little bit difficult because I'm not a specialist yet, but I think talking to as many faculty members, some faculty members will tell you, you know, I'm a prosthodontist, but I wish I went into perio, or I did OS, but I didn't have that balance that I needed, so I wish I went into perio. Like things like that. Those things are very, very important. But digital dentistry is important to me. I have had experience in implant dentistry during my gap year, so that's really important to me. And I think as a general dentist, I'm able to choose the cases that I take on based on my comfort level, and I don't lock myself into doing certain things that I don't feel comfortable doing at this point. And yeah, I just really love general dentistry over all of the other specialties at this point, but I will definitely keep everyone updated on where I decide to go for GPR. Okay, so I think we're kind of coming to an end, but what my typical day is like, this is definitely going to change whether you're D1, D2, D3 at Stony Brook, but I wake up around 7-ish, 7:30. I do a quick stretch that is very important to me because you start to feel a lot of chronic back pain as a dental student from all of the stress, from all of like the hunching over. I make breakfast. 8 to 10, we usually have didactic courses, and then we have clinic in the morning, clinic in the afternoon, you have dinner, and then that's kind of your free time. You can either do lab work for your patients, you can study, you can do extracurricular activities. For me, a lot of my time gets prioritized. Extracurriculars, they kind of come first, and it really depends day to day. But overall, we are in school from 8 to 5. And I think it's very doable. There's plenty of time to study. It just depends on what your goals are. If you want to go into OS, it's really important, or ortho, it's really important to have a high GPA in dental school, right? So based on those things, that's kind of where your after school activity time is going to differ. Okay, so I wanted to talk a little bit about mentorship in general because I personally think it's key to getting that success that you're looking for. So I really like this quote. It is, a mentor is someone who sees more talent and ability within you than you see in yourself and helps bring it out of you. So I think that this is really important because I find that a lot of the pre-dental students that I talk to don't always believe in themselves as much as I feel like they should, don't really portray their strengths as much as they should in an application, and are not very confident in general. And that can come from a bad grade, or not feeling like you can get in, or, you know, what, or even having doubts whether you want to go into dentistry in the first place. So a mentor is someone who can guide you through that, and especially when it comes to someone who's gone through the process and is a dentist already. That's something that's really, really key. Because you want to realize that the pre-health advisors that you talk to, they're not always dentists, and they did not really go through all of the dental school applications. So there's a lot of, I feel like, discouragement that comes from dental advisors sometimes. And I think that that has to do with the fact that they're trying to get as many people to get accepted. So if they feel like your application is not strong enough, sometimes they tell you to take a gap year. But what's really important is to know what's important for yourself, what your gut feeling is. And if you want to apply, you should definitely apply that year. If you think a gap year is the right thing for you, but your parents are pushing you not to take it, you should do what's best for you. And so mentorship for me was the key to all of my, I'm going to say, success so far in terms of getting into dental school, in terms of, you know, being able to thrive in dental school and all of the events leading up to it. So that's something that's really important. And I do want to mention that what I serve right now is more so like an advisor, a mentor, a coach, some people say, but basically someone that they can tell things to and we can strategize for the application process, right? Because everyone is so individual, and for some people a post-bac program is indicated, for some people a master's is a better way to go, and then there's some people who just need to buckle down, study for the DAT, and apply that cycle. So there are very, very specific strategies that I help students work through to work on their weaknesses, highlight their strengths, and become more confident. So I wanted to kind of do a little plug there because there are ways that you can kind of get that mentorship for yourself. So just like a small summary, usually you want to like, so what I do normally is an intro session where we talk about like goals and the dental schools you want to go into. And then there's like various different ways you can either do once a month or, you know, coaching, motivational, anything like that. And something that I pride myself in is just being part of ASDA has given me a chance to talk to a lot of dental students and know a lot of colleagues. So when people get into interviews at various schools, something that I love doing is connecting people. So if someone got an interview at NYU, I can connect you with some NYU students so that you can get their firsthand experience. So that's something that I wanted to mention because I think that pre-dental students have a lot of stress. And I think that the only way is to really be able to talk things out and become more confident in yourself. Okay, so I guess that's all I had in terms of content. And yeah, thanks for listening.
So now we will be starting the Q&A portion. And our first question says, I went to Stony for undergrad, but really struggled with the competitive atmosphere. Are students at Stony Brook Dental competitive as well?
Yeah, that's a great question. I think that that should definitely be one of those factors that people think about. I don't think we are competitive at all, but I think that it's definitely something that our class, like I love our class, we're great. I don't want to sound cliche and say that we're supportive, but I think that we have a great leadership in terms of like our class president, our vice president, and those are the people that really advocate for us and get our concerns heard by administration. So that's something that's really valuable at Stony Brook, because if we have an issue with something, there's a dean's meeting, there's a monthly GPM meeting where we can say, hey, that's not working for us. Can you change it to this? Or we had some of our curriculum changes as well. And that's just because our leadership was, our class president was advocating for us. In terms of competitiveness, I don't feel it. I think that it really, I'm going to be honest, I think it's also going to depend on the specialty that you're going to go into. So I will say that if you are going into ortho or OS, there tends to be some competitiveness. I don't think in our school there is that, because especially for OS, they have journal club and they go to surgeries together, that sort of thing. So I don't think we're competitive. I really do feel for you in terms of the undergraduate experience. I think it's very different. And as an undergraduate, everyone seems to be having different goals and then feeling like they're competing against each other. But at the end of the day, if you're a pre-dent and you're applying and there's someone else in your class who's also a pre-dent, chances are you are looking for different things out of a dental school. Chances are you are a completely different applicant than the other person. And there shouldn't be any comparison, because at the end of the day, you want to get into the school that you want to get into, not the school that this person's trying to get into, right? And I do think that everything works out for a reason. So if you don't get in on the first time, then you are going to be so much more mature, so much wiser, and get in on that second try. That was my long answer, but the short story is I don't think we're competitive at all. We have social events. We're, really good in terms of our class, whether it be borrowing things or helping each other out in doing lab work, simulation lab, like that sort of thing. I think we're pretty good with that at Stony Brook. Thanks.
Next question says, how was your experience with the professors?
Okay. So I think that when it comes to professors, I truly think that there are mentors within professors in everyone. And I find that some students with similar personalities tend to kind of gravitate towards faculty, for example. So if you're super outgoing, you may start to bond and really create a relationship with a faculty member that tends to be outgoing too, that shows up to events, that sort of thing. So like attracts like in that sense. I've had really good experiences with my professors. I think that out of the whole residency application, the most stressful part for me is the personal statement. It's not necessarily finding letters of recommendation. And that's something that is unique to Stony Brook because we only have about 45, 46 students in each class. So it is 100% up to you to make yourself known to the faculty members, right? So let's say you go to NYU. Yes, it's maybe a little bit harder, but I feel like it's up to you to talk to them, to bond with them, to talk to them about the things that you're hoping to achieve in dental school, and really connect with them. And that I think is a very, very valuable skill that doesn't get taught in undergrad or dental school. So my professors are great. But I think a lot of it has to do with your own personality type and how you put yourself out there, because public speaking, communication, managing difficult situations, that's something that's really important that isn't taught, like I said. But those are ways that you can connect with your professors much easier. But our dean is also great. Our interim dean, Dr. Kusine, he's very open to everything. And I've had multiple conversations with him. There are times where we can just go to his office or schedule an appointment with any of our faculty members. So I think that's the upside, definitely, of Stony Brook.
Next question says, can someone graduate as a general dentist, then choose to specialize later on?
Yes, absolutely. The only thing with that is I don't know if you can like graduate, go into a specialty, and then go back to general dentistry. From my understanding, I don't know about that. But once you graduate, you can do a GPR or you can go into private practice. And in private practice or GPR, you realize you really love doing molar endo and you love doing root canals, and then you can choose to specialize. So if you are looking to become a root canal specialist, a lot of programs actually require for you to do a GPR, because a lot of times if your school is not strong in, graduation requirements in root canals, then you will graduate with like 3-4 canals, and that's not nearly enough clinical exposure for you to know that that's what you want to do, that you want to become an endodontist, right? So they require for you to do a GPR so that you get to see a little bit of everything and then really focus on doing endo. So you 100% can take your time in figuring out what you want. A lot of people do GPRs and then pedo sometimes. Some people who don't match the first time around, let's say to OS or ortho or any other specialty, they do a GPR and then they apply again. So you can definitely become a general dentist first.
How do you think COVID is changing the dental field?
That is a great question. And hint, hint, this is an awesome question for when you're on the interview trail, right? Because one good thing is to ask how COVID has changed the curriculum and the student perspective. But I will say, one, there is, just based on the clinical care that we see, we found that a lot of, elderly patients don't feel comfortable coming into the dental school. And I think now it's getting a little bit easier, but for obvious reasons, people that, used to take public transportation weren't able to get the dental care that they need, right? So I think what COVID did was kind of exposed the health disparities that we see in terms of the different barriers to access of care, right? So people who no longer work because of COVID may not have the finances to do all of the treatment that they need to do. So I feel like COVID definitely exposed that. Obviously, PPE is very important. Now we before we used to still, we would wear PPE, but it would be a little bit more lax. Now, we have face shields and N95s like that also affects me physically, right? So when you're doing a 3-hour procedure and you're in N95 and you can barely breathe, it is very difficult to breathe. And breathing is so important to minimize your stress, to manage your stress in stressful environments. And when you're doing something for the first time and everything's so hot, you have your coat on, like it could be a lot. It's physically demanding. I think it has changed the protocols that we follow in the clinic. And dentistry in general, I feel like I've seen a lot of articles saying that in the dental field, COVID doesn't tend to spread as easily as other places. So that might be something to note, but that's also a great question, and a great question you should ask your dental schools.
How do you deal with stress or manage your work and life balance?
Mm-hmm. Yeah. So this is something that's really, really important to me because I definitely felt burnt out the first 2 years of dental school. And it wasn't until COVID that really kind of slowed me down. And the key to that is first year is wild. You think you're constantly behind. You try to, watch the lectures, but by the time you do that, you're like a week behind and you're like studying for one exam and then you fall behind in a different exam. Like, it's definitely an adjustment. I think exercise is huge for me. Hobbies, right? So I danced in college. I did gymnastics growing up. I danced in college. That was my form of stress relief, whether it be going to the gym, playing tennis with your friends. Like, you need to have something that adds community to your life, that adds physical movement, right? So I heard this, that just the general concept, a body in motion tends to stay in motion and a body at rest tends to stay at rest. And the way that I think of it is, if you're literally stagnant studying all the time, you are missing out on the opportunities to connect with dental students, to connect with your passions, right? So through my extracurricular activities, I realized that I really want to go into, I love mentoring and I really wanted to go into teaching at some point. That's not something that I would have recognized if I just stayed at home studying 24/7. For me also, I think dance was a big part of it, doing yoga, staying well. I think honestly, talking to someone, and I'll say that there's a lot of stigma obviously with the mental health, but the reality is the dental students do get stressed out. And I don't think that, like, there are resources out there, but I don't think that you're taught how to manage stress. You're just kind of expected to find out how to do it on your own. So for me, I have a wellness coach, someone that I, plan nutrition with and talk about some of the stresses and plan out my life priorities, that sort of thing. So basically kind of like a mentor, but not in the dental field. So that has been so important to me. And I will say that dance has been such a big part of my life. So that's kind of how I de-stress, but knowing your support system. If friends is something that you really need to stay sane, then you should not feel bad saying yes to hanging out with your friends when you should be studying for your exam. Because if you're in the right mindset, you will be more efficient when you come back from that, from hanging out with your friends, and you will still study and you will still probably do just as well. So a lot of D1 students don't really get the hang of not saying no to family and friends, but in real life, that's important. So when you look back, when you're D1 year, I will say my most memorable time was when I volunteered at Common University. That was the time that I met all of the upperclassmen, some faculty members, and that was amazing. I'm not going to say it was that time that I studied for a biochem exam. Like, that's definitely not my favorite memory. So making your memories, I think that that's definitely also a way to de-stress as well. Sorry, very long-winded answer.
Can you discuss some of your shadowing experiences during your undergrad?
Sure, absolutely. So I naturally, okay, so this is how I feel like as a pre-dent, it's harder to get shadowing experience than it is as as a dental student. So just for everyone to know, I still shadow, right? Even though I'm a dental student, I'm a third year, I'm applying to residencies, shadowing is so, so important. And for those that are kind of discouraged by COVID and not being able to have as many opportunities, you have to understand that one, everything is opening up. Two, it's all about how you present yourself. So if you call some places, they don't call back, or you leave some resumes, or if you call one place and they say no, you're discouraged and you're like, wow, I'm never going to find shadowing experience. I think the way that I approach shadowing is if you ask 100 places, I'm going to bet that some of them will return your call, right? So for me, I think it's all about quantity at first, and learning how to conduct yourself during a shadowing experience, right? So at the beginning, you're probably just standing there quietly in the corner and you feel like you're always in the way and you feel awkward. Like that is the first step to shadowing. The second step is really formulating questions that are, are good questions. They show your interest, and that's how you start to get a relationship with some of the dentists. For me, I started with a family friend, and I shadowed her, and that was my first experience. And I was looking at, oh, like, wow, this is how they do things, and like this is how she talks to the patients, and the patients really love her, and she's just very nice, and things like that. Once you start shadowing as maybe a third year or junior in college, you'll start to see, oh, why do they choose to do an implant here instead of a 3-unit bridge? Why did the patient mention specifically that they need to do a special lab test before they come into the dental visit, right? So what I'm saying is your experiences throughout college change. First, you're just standing there awkward. Then you have more confidence to even introduce yourself to the patient, maybe even suction a little bit or whatever it may be. And the more you do that, the more comfortable you get. And the more people you ask, the more people will say yes. And I really commend the social media aspect of things and being able to give virtual shadowing opportunities to students. We didn't have that. We barely had Instagram or YouTube channels. Like that was definitely not some of the resources that I had. So that's really good. But I would just ask dental students. For example, like I'm one of the alumni reps, and when someone asks me, oh, I want to shadow somewhere around Stony Brook, I can already positively give you a list of people and I can introduce you. So usually when people do that, you can just send an email saying, hi, Dr. So-and-so, I have a pre-dental student who's great and she's looking for a shadowing opportunity. Would you be comfortable, with them coming in for a day? You don't need to commit yourself to saying, I'm going to come in on every Tuesday for 8 hours for the next 12 weeks. Like you don't have to do that. I think one opportunity, one day is enough for you to see whether you would want to continue shadowing, whether you got enough out of that and you want to shadow another dentist to see how their practice is set up. So I think that it kind of comes in stages. So the first one was a family friend. The other one was a dentist that I shadowed at my work. So where I worked at Vicon Dental Implants. So I did that. And then the third dentist that I shadowed was technically during my global outreach trip, because we brought that dentist with us and I spent all 3-4 days at the dental station. So I was pretty much shadowing her. So that's kind of what I did. Yeah, I hope that answers your question.
What is the clinic experience like at Stony Brook? Do you have to seek out your own patients or are you given them?
Yes. So through Axiom, which is the equivalent of Dentrix for dental schools, we have something that's called a needs request. So you would first of all, let me backtrack. At Stony Brook, for me specifically, our class went into clinic second year. It was around January. So January of second year, we were given a roster of patients. I think I got like 8 to start with or something like that. So we started doing recalls, we started doing cleanings, that sort of thing. And then and then it ramps up. So right now I have about a roster of 22 patients, and this is all like post-COVID. It's obviously been a little bit hard for us to get the experience that we need with all of the time that we have lost, but I have been managing around 22 patients right now for myself, and I am required to do all of the treatment that's necessary, right? So those patients were given to me, none of which I had to find on the street or at the mall. Like, we didn't have to do that. If you do have family or friends who want to see you, you can do that. I know plenty of people who bring their parents in, etc. But at Stony Brook, we just request it, and they constantly do screenings, and they basically organize all of the screened patients based on the amount of needs that they need. So if I need crowns, I will ask for a crowns patient, and I will be assigned the crowns patient. And then you would do their initial exam. You would have to do all of the cleanings before you can get to the crown, because at Stony Brook we have interdisciplinary type of approach. So you're not just saying, we're not like block rotations, which some schools are. So if you go to a different school and it's like oral surgery rotation, you go to oral surgery, whatever patient's in that chair, you get to extract their teeth. We don't have that. We have to work up the patient, we have to do all of the treatment planning, and we're responsible for doing all of the fillings, all of the crowns, and all of the dentures on those patients. So it's a little bit different, but the short story is, no, we don't have to seek out those patients. Those are given to us, and it's up to you to be able to manage your roster as is. And I know as a D4, there's some people who had like 50 people on their roster or something.
What is something that you wish you'd done differently in dental school?
Yes. So I think that I would not change my involvement with extracurriculars. I think I got involved early on, and I encourage everyone else to do that, because that kind of opened the door to more opportunities. So when it comes to extracurricular activities, it's like a snowball effect. You sign up to do a small role, like be a D1 rep for ASDA, for example. And then as a year 2, you start to get a better understanding of how the organization works. And then you sign up for more things and more things and more things. So for people who were like, oh, first year, I'm just going to study, and then I'll get involved like second year. And then COVID hit, and then we're applying for residencies, right? So I would not, like, if you want to do something, I would say that you should start doing it earlier on. So that I think would is something that I don't regret doing, but I think just tuning into more of my health and wellness aspect of things, because I was very stressed out about things that, looking back, I feel like if I approached it in a different mindset, I would have gotten a better experience from it, and just to know my strengths. So I knew that my medical school courses in D1 year were not my strengths, and I just wish I took it a little bit more, of a different approach to it. Instead of seeing it as my weakness, I wish I kind of did the best that I could without the stress associated with it. And I think the same goes for pre-dental students. The pre-dental application does not have to be stressful, although it tends to be sometimes. But I think if you strategize and think and reflect on how you work best and study best, I don't think it has to be stressful. There are ways to kind of alleviate that stress. And for me, and what I do with the pre-dental students is just strategizing. What are you going to achieve in the next week? And having some accountability to that, because I know that with personal statements, people say, oh, I'm going to write it, and then they don't for like 2 months. When you're being mentored by someone, that's someone who's going to be like, hey, how's that going on? And it keeps you accountable, and it pushes you to, keep doing those things. So I think the stress, I wish I managed my stress better. And I don't really have any other regrets. I think that it was just really stressful. It was stressful for me specifically because I was out of classes for a year and a half because I took a gap year. So that transition was a little rough for me.
Okay, another question says, do you recommend shadowing multiple dentists, or is it better to get the same hours by shadowing one dentist?
Okay. I think it's really going to depend on a couple of things. One, are you trying to get a letter of recommendation from that dentist? If so, then I would say the goal would be to shadow them over a longer period of time. So it's better for you to do once a week for 4 months than for you to go in every single day during winter break, because they are able to see your growth and see you constantly. And that's how you start to foster the relationship. Now, another big tip for shadowing: you don't want to just come there, ask them some questions, and leave. You also want to start to ask them questions about their personal life, like not just about, oh, why did you use that cement? You want to ask them what dental school they went to. Do they wish they did anything differently? Share some of the things that you're interested in. If you are in some sort of sports team, or if you are doing some community service project, it's as easy as, oh, what are you doing for the weekend? Like if anyone asks you, and then you kind of give them the plug, like, oh, I'm actually doing this trip, or I am going to volunteer out so and so, or actually I work at this place. Those are ways that they can get to know you. So if the goal is to get a letter of rec, I would say frequency wise, like maybe once a week for a longer period of time. If your goal is to determine whether dentistry is the right field for you, I would say many dentists at various times, right? So you don't have to commit to doing something for 4 months with them. It's as easy as going to one endodontist, maybe going to a general dentist in a DSO, a big corporate company, or going to a general dentist in a small, like mom and pop type of office, or a multi-specialty practice. So if you're like a D1 and you kind of want to do PA, maybe PT, maybe doctor, maybe dentist, I would say going to as many different places to see if like that's your vibe. Let's see what other scenarios. If you are like time crunch right now, let's say, and you're applying in August, I would say that you should have the duration looks better, in my opinion. I feel like it's better for them to see that you've been shadowing for a consistent period of time, because you'll find on the shadowing hours where you get to describe it, there's going to be a like the company name, what your role is, what kind of opportunity it was, whether it was shadowing, volunteering, etc. And then it's going to ask you for the time frame. So if you write just one day, then it doesn't look as good as if you wrote September 2019 to September 2022. That I feel like shows more commitment and more dedication. And definitely like be honest when it comes to that. No one's going to check it really, but you don't want to start off your dental school application with not being honest. So I hope that answers the question.
Okay, so we have our last and final question. And what has been your favorite class thus far through dental school?
Okay, that's a good question. So I will say that from the didactic standpoint, I really liked this one class. It's basically like microbiome, but one of the resources that we all use is called the Sketchy Micro. And what it is, it sounds really silly, but basically they would draw out an illustration, and it's something silly like, like, I don't even know, like a farmer on a farm that's sitting by a cactus, like, but each thing symbolizes a certain characteristic of that microbacteria. Okay. So that was one of my favorite resources. You just watch these videos as they explain, like the farmer is wearing a hat, which represents like something, and that is one way to remember everything. And I used to love watching those videos. And to this day, like I feel like I still remember specific pathogens and the different like characteristics. So from a didactic standpoint, from first year, I really loved that class. I would say hand skills wise, I really like dental morphology, which was the waxing up a tooth type of thing, and I ended up doing really well, and I became a head TA. And I think that that's kind of what also prompted my love for teaching and mentoring students. So that I think was the most meaningful for me. Otherwise, I like clinic. I think that you learned, I don't really like oral pathology. I will say there's a lot to memorize and all of it looks the same. But just any dental courses, more so than the medical school courses, are the ones that I enjoy the most.
Okay, thank you, Diana, for taking your time to talk about your profession. We greatly appreciate it. And to our viewers, just a reminder that we don't have a quiz today. You can find more information in our link tree in our Instagram bio. To Diana, again, I want to thank you again for talking to us today.
No problem.
And thank you, everyone, and have a great day.